Hi guys, may buntag sa inyong tanan. May aga lang din sa inyo, mga parekoy. Magandang umaga, mga kaibigan. And good morning, friends. Before I devoted myself in cosmetic dentistry, I was actually trained at the UP PGH for surgical dentistry and hospital dentistry as well. I've handled a lot of surgical cases. So now I will be talking about dental extraction or pruning. That is really one of the basic procedure done in a dental clinic. So it has been 2 months that we are under ECQ due to COVID-19.
The Philippine government expands and extends the country's enhanced community quarantine until May 15th.
Madami pong nagte-text, nagsisend a message sa amin that they're experiencing yung pain and they really wanted to have extraction. Why we seek dental extraction treatment from our dentists. First, if the patient is having an excruciating pain. Second is infection. This is very common, especially if there's cavity or caries. So once there's caries and it proliferates and it hits the pulp, then that's a time that it would cause infection. It will spread not just on the pulp but also on the surrounding tissues of the teeth. It affects also bone. When feeling with infection, nagkakaroon ng swelling. So, mafe-feel niyo yun, medyo may pressure inside. And also, there's pus. May mga nana na parang lumalabas. So, associated with pain. And sometimes, nagkakalagnat. Third is trauma. Let's say, for example, na-accident ka or kumain ka ng matigas. Okay? It can damage the teeth. It would cause infection as well. Fourth is pyorrhea alveolaris or periodontal problems. Usually nangyayari yon if hindi masyadong nalinisan yung ngipin. And calcular deposits can go straight to the bone and would damage supporting structure. Pag wala na masyadong bone, that's the time na we have to extract the tooth pag hindi na kaya ma-save. Fifth is badly carious tooth. Let's say for example, nagkaroon ng sira yung ngipin pero sobrang laki. Okay? And there's no furrow, we won't be able to save it with the normal root canal treatment. So extraction is the best. Sixth is impacted teeth that's causing problems such as pain or difficult to brush that area. It will damage the adjacent. It will also give pressure if it's not removed. And sometimes it will damage the occlusion of the teeth. So what are the contraindications for dental extraction? First is heart problem, or the most common is rheumatic heart disease. RHD patients have a risk of having subacute bacterial endocarditis. Because once we extract the tooth, ang nangyayari, there's a frequent presence of the Streptococcus viridans. It goes in the bloodstream. Tapos ang nangyayari, that's called bacteremia. So bumabalik yan lahat sa heart. Okay? So once compromised yung heart mo, it's not strong enough to withstand with the bacteria.
Uncontrolled infection can have serious effects on the body, result in organ failure and even death.
That's why antibiotic treatment is very important. Before we can give you the antibiotics, we have to make sure that you have properly disclosed your medical history. That's why we asked thoroughly. We found out that you have this problem, then we can refer you to a cardiologist before we can do any surgery or any extraction. So another common contraindication is if the patient is taking anticoagulant drugs to get that normal level of thrombin in the body or in the blood. If you stop anticoagulant drugs, it can cause a thromboembolic accident, which is life-threatening. So we have to make sure that you have a normal thrombin levels first. You cannot stop medication without the physician's advice. Uncontrolled diabetes mellitus. This is one of the most common problems associated in dentistry. So before we can do extraction, okay, we have to make sure that it is controlled. Why? Because if it's uncontrolled, the healing would be difficult. So pag hindi siya properly healed, infection can occur. It can worsen the condition. And lastly, for immunocompromised patients, they have reduced the ability to heal properly as compared to normal patients. The reason why we are taking the medical history very seriously, it's because of contraindications. That would be life-threatening to the patients. We have to make sure that we do a proper clinical assessment. It's not just about taking the history and asking for the chief complaint, but also we have a chance to check the blood pressure of the patient. If it's beyond normal limits, then that's a red flag. We might send them to a medical doctor for proper or further assessment of the case. And also, we need to check the heart rate and the pulse rate of the patient if it's beyond normal limits as well. Totality of the physical aspect, like the gait, how it looks like, kung anong itsura ng pasyente, if there's any cyanosis of the lips, the fingernails, or the tongue, and if the patient is may tachycardia or nagkakaroon siya ng mabilis na pintig ng puso, something like that, like jaundice. So we have to defer the case first. Usually, pag pumupunta sa clinic kasi, gusto talaga ipilit na magpabunod. But, we can't do that. Okay? Because we want to make sure that the patient, you, are okay. Not just during, but after the extraction. So the reason why we are taking dental x-ray is for us to make sure the position of the tooth and the condition of the root of the tooth, if it's embedded with the bone, because pag hindi namin nakuha yun, it would be very difficult for us to extract the tooth. And also we can be able to check if there's infection. In our dental clinic, we are following these guidelines to ensure the safety, not just for us, but also the safety of our patients. So one of the reasons why we are doing extraction, it's because we don't want to prolong the usage of any mefenamic acid, which is the most common pain reliever in the market, and also antibiotics. If there's an infection and then the patient will take antibiotics for a very long time, it could cause resistance of the microorganisms or the bacteria. Then it will not be effective. It will go to a higher level antibiotics. So mangyayari, it will compromise the liver and the kidney. So we don't want that. The best approach for any dental problems or dental infection is that you have to take antibiotics, and then after a week or two, you have to extract the tooth. Although our topic is about dental extraction, we have to remember that there are multiple treatment available, such as root canal treatment or a periodontal treatment. It doesn't mean that there's pain. It's always indicated for extraction. Please like our video and subscribe to our channel. Thank you, and God bless us all.